Now we should know about the classical differences between the benign and malignant tumors. First, let us talk about what are the benign tumors over here. Benign tumors usually end with the suffix called as -oma. Example, adenoma, papilloma, fibroma, chondroma, osteoma. On the other hand, if you see, what exactly is the malignant neoplasms? These malignant neoplasms end with the suffix carcinoma if it is epithelial in origin, with the suffix sarcoma if mesenchymal in origin. Example, adenocarcinoma, papillary carcinoma, rhabdomyosarcoma, osteosarcoma, all these are the best examples for this. Next, if you see the benign ones again, they are usually well encapsulated with a well demarcated border, what you can see very clearly in this picture. And on the other hand, if you see the malignant one, it has no capsule, well to undifferentiated border. And if you see the benign ones again, they usually grow slowly and are generally non-invasive and do not metastasize. But on the other hand, the malignant tumors are rapidly growing, they are locally invasive and metastasize. The benign tumors are usually well differentiated and usually resemble their tissue of origin. But the malignant, if you see, most poorly differentiated. And next one, if you see the benign, the cells show normal nuclear cytoplasmic ratio, which is 1:4 to 1:6, what we studied. But if you see the malignant, cells show an increased nuclear cytoplasmic ratio. And the benign tumors has abundant stroma, but there is a scanty stroma in the malignant one. And if you see the benign, the mitotic figures are rare, but on the other hand, if you see the malignant one, there is a high mitotic activity with abnormal mitotic figures, prominent nuclei, and the nuclear hyperchromatism which are typically seen. So all these are the major differences between the benign as well as malignant tumors. If we talk more specifically about malignant tumors once again, in malignant tumors, there will be areas of necrosis and hemorrhage which are seen mainly due to rapid growth of the tumor cells. And here, anaplasia is considered to be the hallmark of the malignant transformation. And metastasis is considered to be the most reliable feature of malignancy. So almost, if you see all the malignant tumors metastasize except glioma as well as rodent ulcer, which do not. Here you can see all the list of incidents, and this is the most common list generally asked in various examinations. Next we will talk about rate of growth of tumor cells. The tumor cells have higher growth rate when compared to that of the normal tissue. And if you talk about clinically detectable tumor, which is seen when tumor cells are greater than 1×10⁹, and the tumor mass is about 1 gram and should have 30 cells doubling to get detected. This is how you can identify the growth of the tumor.